So today we're gonna start another important topic which is related to dentistry. So let's start it. Bismillah Rahman Rahim. So basically, it is occupational hazards in dentistry. Basically, what are occupational hazards? If I give you a summary, it's basically the risk that the dental professions are exposed. Means those people that are practicing, so they are exposed during their clinical practice that may affect their health, physically, mentally, psychologically, their well-being, their social life also. So and also their professional performance are also affected during occupational hazards. Now giving you a summary actually, so first of all we will study about physical hazards, then we have actually chemical hazards, then we have biological hazards, psychological hazards. Okay, then we will also study about some that how to prevent these hazards. Now moving forward, occupational hazards. So basically occupational hazards, they impact your general health in long run. The dentist might not be aware in the short term or in a short period of time, but after years that person start feeling something that there is a change in her or him in him body actually in a long term. So but dental care has also been revolutionized due to information and technology advances. Means the dental care has been advances in the information as well as in technology. Dentists and their team is exposed to hazards that are peculiar to these professions, mean unexpected, means they do not expect actually, but they are exposed to those hazards actually. Now basically actually occupational hazards are physically, mentally and social sorry, occupational health is actually maintained to the highest degree your physical health, your mental health, your social well-being of all the personnel working in all the occupations. Means the occupational health means that you have to maintain your physical as well, your mental and your social well-being during the work in all the professions. Now, occupational health signifies that long-term, short-term risk, which I have told you, with the workplace environment. In short-term, like you have actually physical injury, okay, physical injury, like you have some prick actually from any burr. Then in long-term risk, it may increase the risk of developing a cancer and heart disease. We will also study the how it actually develop a cancer, even a heart disease actually. Now, which I have told you, the hazards we will study here is actually physical, chemical and biological. Then we have mechanical hazards. Then we have psychological hazards actually. Now moving towards the first physical hazards, in which we will study about heat, light, noise, UV radiation, computers, lasers and sharps, and how this actually affects the physical health actually of the patient. First of all, electrical hazards. Now what are actually electrical hazards? Electrical hazards are actually when electrical hazards in the form of heat is means, then it is a risk of like shock, burn or a fire that can be caused by an improper use of electrical equipment during the dental clinic. Okay, now we can talk about the dental chair unit. Okay, sometimes mostly the dental chairs are powered electrically, and the faulty wiring sometimes been they are present and cause shocks. Okay, then you have actually also like devices like handpiece also. Okay, then you have actually autoclaves, sterilizers. Okay, now when how this cause means the how the birds cause actually when you does not properly maintain those equipments, means when they are broken down, when they are malfunction, means, and then also you do not understand them, lack of understanding or lack of information about that instrument. Okay, that electrical instrument, lack of its control, that you do not know how to hold that instrument. First of all, there is always a specific way to hold a instrument. So if you does not know these things, means if it is not properly maintained, if you does not understand about it, and if you does not know how to hold actually, how to control on it, then it cause painful shocks and burns. Okay, now moving towards the light as a physical hazard in the form of Poor illumination. When there is not properly light, so it causes eye pain, eye strain, headache, eye fatigue even. Excessive brightness, it causes discomfort, annoying, and visual fatigue. How to prevent this very important. Sufficient and suitable lighting and natural or artificial lighting means proper lighting is been very important. Okay, during any procedure you need proper lighting. Either it can be your scaling, either it can be your filling, either it can be anything. You need proper light. Coming towards the noise, how it is a physical hazard. Use of high speed turbine, compressor, or ultrasonic scaler, it causes a lot of noise. We know it actually. Auditory, like it can cause temporary or permanent hearing loss. Non-auditory, it can cause fatigue, interference with communication by speech, decrease the frequency, and annoyance. Now, ultraviolet light radiation, computer and laser. It can how effects of computer lasers. It can eyes are affected, causing intensive conjunctivitis or keratitis. Okay, means actually basically. Then how effects of radiation. So the effects of radiations are cumulative, and this can damage it totally. A painless yet a life-threatening, means it does not cause the pain at that moment, but it is a life, like in acute condition you have arrhythmia, dermatitis. It can cause also skin cancer that we have talked earlier, bone marrow suppression. Genetic effects may lead to the congenital defects in the offsprings during pregnancy. Very important point. If a woman, she is actually a dentist and she is working in the x-ray department or radiological department, so that woman may be affected, her baby may be affected during that practice actually. Okay, now how to prevent means. So International Commission of Radiology Protection has set the maximum permissible level of the occupational exposure of 5 frame per year to the whole body. Very important point. The why this is actually, the goal is to minimize the radiation exposure of the official personnel patient during the radiographic examination of both the patient as well as the dentist also. Recommendation for safety: the buying a standard radiographic equipment which allows the National Council on Radiation Protection and Measurement and ICI recommendations. Well collimated and filtered beam of the at least 1.5 millimeter of the aluminium filtration should be available. Very important point. These safety measures. Use of lead barriers, very important, between the dental surgeon and x-ray machine is mandatory. The lead should be in 2 millimeter thick. The lead should be extended at least 12 inches below the floor of the level. Very important. This is showing how the x-ray affects the patient, also even the detector. So it's very important. So you can see there is a lead barrier actually. Then you have actually a special conch shell shaped designs which are recommended to you actually during the x-ray department. Special barium plasters are very important also. And then you have lead apron actually. Then special thyroid shield, which is very important. Sometimes the radiation can cause cancer even to the there is actually a thyroid cancer. Fast flames use. Okay, basically you can see here these all things. Now moving towards, dental surgeons should also use a flame badge service for personal monitoring. It has a radio-sensitive crystals by which the quantity is determined. It is known as dosimeter or justification of the radiographic examination. Now limiting the possibility of occupational exposure, radiation safety procedures are followed by all. The operator should leave the room or take a position behind suitable barrier or wall during the exposure of the flame. Wall must be in sufficient density or thickness. The operator should be stand at least 6 feet from the patient or angle of 90 to 135 to the central ray of the x-ray beam. Flame should be in place by the operator. Use actually a flame holding instrument. Radiographic tube should be never be stabilized by the operator or the patient during exposure. Very important point. In the last we have actually sharps, so means like glass or needles, lasers, BP blades, broken ampoules, test tubes. How to prevent, handle with the care, manage and dispose waste sharps as per the guidelines by biomedical waste management and handling rules. This is the yellowish, and you have also a sign of danger. Sharp disposal.